I've been in general practice for 36 years. I feel like I've seen it play out over all that time. And I feel at the moment that this most recent announcement is Tony Abbott, Health Minister 2.0. I felt like I saw this 20 years ago when bulk billing rates were dropping. And it seems to be that it's a process of niggling away and not having Medicare keep up with inflation even, let alone the actual cost of providing health care. And I listen to the other people in this audience and I so want to say, I'm not a greedy doctor, I'm not after the money. I have been bulk billing for years. I have this intimate relationship with my patients, which means that I feel guilty about charging them money. And this is the way a lot of GPs feel. When bulk billing rates drop, it's not because we're trying to support our lifestyle, it's because we need to drop it in order to keep our practices alive. And as our practice slowly dies of old age and the lack of new blood coming in, as our 11-doctor practice was down to 5.5 at the beginning of the year, we've got a first-year GP trainee and a 60-plus-year-old local doctor who's joined us to make it up to 7.5, stares down the barrel of the next 5 years. 6 of us there are over the age of 60. If we all retire, and we easily could, the practice closes. And then there's just one other thought that came to me in the midst of all this, and then I'll shut up. The urgent care clinics. I know they're being touted as a wonderful new thing, but then I think, but hold it, I do urgent care. I've always done urgent care. I've always done suturing and dealing with fractures and dealing with injuries and dealing with coughs and colds, the stuff where people would come to the front desk and say, I need help. And I still try to fit them in, but I'm just so overwhelmed.